Hello, my name is Tina Gregg. I'm a nurse practitioner at GI Associates in Flowood, Mississippi. I have been here for 18 years where I treat all things liver disease. Of course, that includes MASLD and MASH. So there are a couple of common questions that I typically receive about MASLD and MASH. So I wanted to talk to you briefly about these. One of the questions that I receive is, are liver enzymes always elevated with MASH? And the short answer is no. Liver enzymes are not always elevated with this condition. In fact, normal liver enzymes do not rule out MASH or even advanced fibrosis. So up to 50% of patients with biopsy-proven MASH can have normal ALT and AST, which is very surprising. Liver enzymes also fluctuate. So at one visit, they may be normal. At another visit, they may be elevated. So ALT and AST lack specificity for low-grade inflammation and fibrosis. In advanced disease, the hepatocytes are lost, so enzyme release can actually decline. The normal reference ranges also used by the labs are too high. So for instance, in our clinic, our reference range for elevation for ALT is 52. Well, we know that, many experts advocate much lower cutoff values, 30 for men and 19 for women in some cases. And so the patient can actually have an elevated liver enzyme, though the reference range considers it to be normal. The second question that I often hear, the second question that we're often asked is if statins are safe to use with MASH. This is a very common question that we get. We actually get referrals to our clinic with this question. We also get referrals to our clinic to address this question. So the good news is that statins are not only safe, but they're also beneficial in this population, even in patients that have a mild liver enzyme abnormality or elevation. So multiple large studies and meta-analysis have shown no increase in liver injury in patients with fatty liver disease taking statins. In fact, patients with MASLD are at much higher risk of cardiovascular disease than liver-related mortality. So withholding statins actually does more harm than good. Of course, we do use caution in patients with decompensated cirrhosis, acute hepatitis, but for the majority with MASLD and MASH, statins should be viewed as part of the comprehensive metabolic management, not as a liver risk, and these should be prescribed. This ends my FAQ. I hope you found it to be beneficial, and I do hope that you will visit the GHAPP MASLD Community Network page for additional information. Thank you for your time.